I think there's a common misconception that our sports medicine division is purely for athletes. That's really not the case. You know, sports medicine is kind of a loose term pretty much for any active individual. Within our sports medicine division, we see shoulder injuries, elbow injuries, ankle injuries, knee injuries. You know, in my practice, probably the majority of what I see is related to either shoulder or knee pain. And I treat people of all ages, so I think there's some confusion to think that if you were a 75-year-old patient who maybe plays an occasional game of golf, that you wouldn't be suited in the sports medicine department, and you might be. We treat rotator cuff tears, we treat arthritis, we treat many common degenerative conditions, and certainly I would say my most common patient is not necessarily the 17-year-old baseball or hockey player. It's really a wide range of patients over many different ages. There is some confusion, I think, for sure, when a patient comes and they might question why they're seeing someone in our department. I think probably the biggest confusion may be over shoulder arthritis. Shoulder arthritis, when treated surgically, often requires a shoulder replacement. And so you might argue that a shoulder replacement would be better served in our total joint replacement division, where they're doing hip and knee replacements, often for older individuals. So I definitely have seen some occasional confusion with that, but fortunately we can usually get people directed to the right provider. Terms like total shoulder replacement and reverse total shoulder replacement typically would not go with a traditionally athletic population. I mean, certainly many of the patients that I do shoulder replacements for still do live a very active lifestyle. Tennis players, golfers, skiers, gardeners, I mean, you name it. But I think it's certainly not something you'd think about in a patient aged 20 to 40. You know, we really try to avoid things like shoulder replacement in younger patients just because, you know, there is a limited longevity of those implants. So if you put in a replacement, whether it be hip or knee or shoulder, the younger the patient is, the more wear it's going to have and the more challenge you have over time, because those parts, just like brakes in your car, they don't last forever. Eventually they are going to wear. So there are exceptions. I mean, I have definitely many young patients that you've had to, you know, lean towards replacement because they're patients who have bad arthritis of their joint. They've failed all other treatment alternatives, injections, medicines, therapy, and they just can't get better and they can't live their lifestyle. And when your quality of life is that poor, sometimes you definitely have to go the surgical route, even though it's probably best suited for a patient, you know, typically, without putting a specific parameter on it, you'd think probably 60 and above.